Hi everyone. I'm Jeanette, and I think we're just going to give everybody a few minutes to see if a few people hop on. I think our guest speaker, we're still waiting on her to hop on, so we'll start in a few minutes. Hi, Dr. Scheitler. We're just giving everybody a few minutes. I think we can get started. Today, welcome everyone. And today we have a guest speaker, and our guest speaker is Dr. AJ Scheitler. And she will be talking about the UCLA Data Equity Center and some technical assistance that they could be providing to investigators here. Um, and just a little introduction about Dr. Scheitler. She is a Director of Development and Engagement and Strategic Planning at the UCLA Center of Health Policy and Research. She leads the center's development activities and fosters funder relationships. Dr. Scheitler also manages several large operations at the center, including the Data Equity Center and the National Network of Health Surveys. And additionally, she conducts research projects to provide evidence for policy making in areas of patient experience and intersections of health and education. Prior to joining the center, Dr. Scheitler conducted federal resources development activities for a number of institutions of higher education and lobbied Congress and the federal government for the interests of education organization and post-secondary schools. She has experience at the state government level, as well as having served as the chief of staff for the Florida Senate Minority Leaders. She also holds a doctorate in higher education administration from Northeastern University and a master's degree in adult education and training from Colorado State University and a bachelor's degree in communications from the University of Central Florida. So welcome, Dr. Shandler, and thank you for being on today and taking the time to speak to us.
Absolutely. Can everybody hear me okay? You get a thumbs up. And can everybody see my slides? Yes? Awesome. Okay. Well, greetings from the West Coast, and thank you all for giving me a little time in your afternoon. As Janet mentioned, I am here to talk about a new project that we have launched at the UCLA Center for Health Policy Research that I hope that you all might find useful in your work in some time. So thanks again for having me join and letting me share this wonderful information. I will go over some introductions of the people that I work with because this is definitely not just me. I'll give you an overview of our project and then talk to you about some potential technical assistance topics that our center might be prepared to help some of you with, yet that you may find might be useful for your work. I'm going to talk a little bit about the qualifications of our technical assistance consultants, and then tell you a little bit about the process in case you feel like this is something that you and your colleagues might benefit from. And of course, I will take any questions that you have. I cannot see the chat right now, so if someone wants to just interrupt me, if you have a question about a particular slide that I have up or something that needs an immediate answer, please feel free to just interrupt. This isn't too big a group that I think that would be unmanageable. I want to thank the Robert Wood Johnson Foundation. They are the ones who have conceptualized this center with us and are providing the funding. This specifically has grown out of quite a bit of work together over the years, starting with looking at practices in disaggregating racial and ethnic data, and then providing training and resources to try to help organizations to improve the disaggregation of their racial and ethnic data. And then building on the success of that project, we launched what is now called the Data Equity Center. We know that racial and ethnic disaggregation is often a first step that a lot of organizations take in trying to improve the representation in their data. I will share with you that we did over the pandemic several trainings related to different areas of challenges with disaggregating data. We have everything from why you should disaggregate and who you should be disaggregating, to the very technical, to more practical sides of what are the questions that you should ask to help get at disaggregation, particularly in the mixed race categories, as well as very technical trainings on things like imputation and weighting. Those trainings all still live on our website, and I'm happy to share the connection to those, or I have the website link later on in my presentation, and if you go there and look at our trainings, you will find them all still available on our website in case any of those might interest you. I am joined at UCLA by a fantastic team, including our center director, Ninez Ponce, and Dr. Subabi Terbecker and Rija Shimkadi. Depending on some of the conferences or webinars that you attend, you may see them speaking quite a bit about different areas of data equity, because it is definitely not just me holding up this work. This work is getting a lot of attention. You may see health equity and data equity in a lot of spaces now. There's a lot of conversation going on about it, and we are happy to try to be a part of those conversations and hopefully be a resource. So as I mentioned, we, as part of this project, will be doing some technical assistance, and although we think very highly of ourselves at the Center for Health Policy Research, we know we don't know everything, and we wanted to tap into our extensive network of partners to really bring together some of the best minds and have the best conversations and tap into the best experiences that others have had. And so we've assembled, we believe, a really wonderful bench of organizations to work with us on any of the technical assistance requests that we get, as well as the resource library that we are developing. So we're hopefully you recognize some of these names and recognize them as leaders in this space as well. And so we have several projects at our center that are very focused on data equity, but we don't want anyone to think that, you know, we're only trying to promote the way that we do it and that no one else's voices are contributing to this important conversation. So our main objective for the Data Equity Center is to really increase the representation, the inclusiveness, and the use of really high quality data by the diverse communities that we all know exist in our service areas. And that's not the same exact for everyone, and we recognize that, but we want to help all of the projects that you all may be working on to look with a critical lens at the communities that you are interested in and that your projects serve or are intended to serve. And we want to help to build an understanding of how to work with those communities to get them involved in working with the data, both so that they support the projects, they help contribute their expertise to the projects, but then at the end, with the research and the data that you may be sharing out, that they then can use it and act upon it so that we have a saying here at UCLA at our center that we don't want to produce research that sits on a shelf. We know that academics are particularly focused on, you know, peer-reviewed journal publishing, but that is not a main focus at our center. We want to go above and beyond that to make sure that ultimately any of our, you know, our research reports or policy briefs or fact sheets, and ultimately, certainly the data that we produce is put into the hands of those outside of our center who can truly harness it to be improving health without outside in the community. So that's the objective overall of our center. Now, how are we going to try to get there? We are looking at a framework for research and data projects from the very beginning with the design of the project to the collection and the initial information gathering to the processing of any data that is you know, utilized for this, and that may be data that your projects collect or secondary data that you get. We recognize that, you know, you don't always necessarily have control over the data that you're working with, but either way, we want to help apply a data equity lens to both of those parts of the process, as well as analyzing and then reporting on the data that you have worked with, and ultimately, as I mentioned, distributing that data to ensure that the communities that are hopefully now being represented in data in much better ways have the ability to access that data, understand that data, and act on that data in, again, meaningful ways to try to address health equity that I'm going to guess that most of us in this room are ultimately sort of working towards. So our planned activities, we are being funded to provide technical assistance. It's not unlimited, but we are poised to, you know, help organizations in a meaningful, hands-on way to come in and understand an objective that you're trying to achieve and maybe a barrier that you've run up against, and pull from our expertise to try to help you work on any of those challenges that you're dealing with. In addition, we are curating a resource library, and I've got the website up there on my slide, and I'm happy to, you know, these slides can be shared with you, and I'm happy to, after I'm done, put this in the chat. We are, the resource library is currently being built. There are some things in there already, but we plan on, we're taking our time to really build it out because we're trying to make this as curated and vetted as possible. This is not going to be a dump of information, so that if you're looking on trying to work on, you know, dealing with missing data, you're not going to come to our resource library and find 20 articles and 2 presentations and 3 fact sheets. That is not what we are trying to do. We really are trying to put together a meaningful organized library that would help you identify the best resource for the question you are trying to address. And so that is currently under construction, but over time, we really do want this to be a first stop place for any of those of you that have questions on working with data to come and hopefully as quickly as possible be able to find the answers to your questions. For example, the trainings that I mentioned earlier that were all related to racial and ethnic data disaggregation, we have a listing of all of the webinars were 60 to 90 minutes, but we have gone through and tagged them, timestamped them, so that if there's a specific question that you were looking for, you can find exactly where in the webinar you could go to watch the segment that's on the topic that you're most interested in. So you're not trying to fast forward and rewind through an entire 90-minute presentation just to get the 10 minutes that it addresses your question. We are also putting together some training workshops. We launched officially back in November, and some of the early requests that we have gotten for technical assistance were, can you come in and provide some training for us? And so based on that, we are putting together a whole series of trainings that will sort of a little bit reflect the same approach that we took in the data disaggregation trainings, in that there will be some that will be very high level. What is data equity? Why is it important for those organizations that still need to work to convince some people as to why we should be working toward this in our research and data work? To the more technical aspects. How do you apply a data equity lens to research design? How do you engage with the communities that you're trying to work with and represent? How do you apply an equity lens to the analysis phase and the dissemination phases? And so all of these, as we put them together and actually get them filmed, will be up on our website, and this is available to anyone to come and view. And then you can reach out to us with questions that might be specific to your particular needs based on the information that are in those training workshops. And so we really hope over the next 8 months to get a lot of those up and live on our website, and hopefully be a really good resource for folks to come and utilize. So what are we talking about with data equity? Now, as I mentioned, we recognize that not everybody is looking for exactly the same thing, and not everybody's ready to take the same steps. We in California are very lucky that we have a very diverse population, and so we have a long history of looking at a lot of these different groups and communities. And so we are building on that experience, but we also, again, back to my roster of technical assistance consultants, we're bringing them in because we recognize that not everybody's experience is the same. Not everybody has population sizes like we do in California for some populations that you want to reach. And not everybody's goals are the same. And so these are just examples of some of the areas of equity that we have been gearing up, both again with our consultants and with our library, to try to address, such that if one of your focuses is really to try to improve your collection around disability measures, that we're going to have the information that you're looking for to try to take that expansion as your next step. Examples of TA topics. Now, this list has been put together in anticipation of our original launch. And so we didn't know, we weren't really sure what people were gonna come to us about. Our center is about to turn 30 years old. We run the California Health Interview Survey, which is the largest state-based population health survey in the country. And over those 30 years, we have had a lot of folks reach out to us about different issues that they were having, specifically or in particular in the survey space. But so we started to build on that and understand that those were possibly a lot of the areas in which we were going to get requests. So again, these are just examples, but these are things that as, again, we build the library and work on our TA resources that we are starting with, that we anticipate folks are going to have challenges with. And so this is what we're already gearing up to be able to help you with if you chose to come to our center and ask for some assistance with your projects. We entertain other areas. We recognize everything is unique. And so just because you may not see something that you're experiencing on this list, please don't let that stop you if you think that, you have a challenge that we might be able to find. Because again, we got diverse voices on our consulting bench, and we'll work very hard to try to find somebody who can help you with specifically what it is that your unique project is experiencing. So if you're interested, send me an email. It's going to be on the next slide. Let me know what your organization was, who I can talk to. If there's a group of you, working on a project, a team, we'd like to know who that is. Then tell us what the goals of your project are. What are the specific data equity goals that you have for that project? What's important to you? And are there specific tasks that you would like some assistance with? And again, we will either kind of direct you to some resources if we have them, or if it's so unique, we need some hands-on stuff for you, we'll put together a team to try to work with you. And if we understand your overall project timeline, we can make sure that we are making sure that we can respond to you in a way that works for, I know, everybody's very heavy workloads and whatever your needs are. So if you'll send me all of that information, I will be happy to review it with our team and see whether or not we're able to help you and put together some advisors to get together with you and hopefully move along with your challenges. The other thing we're going to be doing as part of this project is, as we're providing technical assistance to groups, is we're going to be monitoring that process and looking for opportunities to maybe develop case studies or models or tools that are applied to one project, but that could be helpful more broadly. And then we will be, again, sharing those in our resource library so that even though we may have, been asked to do TA for one project, we might recognize that, there may be a lot of organizations or individuals who would benefit from this kind of information. And we will work to share that out with everybody so that this is a learning community, so that we're all benefiting from the experiences of others as everybody hopefully is trying to advance the quality of their data and the representativeness of it to really address the health issues in all of these unique communities that deserve some attention and some representation in all of the variety of data sources that we all get to work with. So there we have it. That's my overview, but I am happy to take any and all questions from everyone and hopefully give you a really good idea of what we can hopefully help you with.
Thank you so much, Dr. Scheitler. I have one question for you.
Right on.
How long is this service available? Is there is this
So
for
we are funded for a little over 2 more years from Robert Wood Johnson, but we are already working on additional funding resources to keep this going, because this is not a single project. This is a center we hope to stand up and have living on in perpetuity. So at the moment, we've got more than 2 years of funding left from the current resource, but we're already focused on building a sustainability model for this project.
Thank you. Does anybody else have a question?
Yeah, this is Debbie Conkle Parker from University of Mississippi Medical Center. I wondered
Hi there.
Hi. I wondered if you, well, here, let me show my face. I wondered if it makes sense, it would make sense to I was thinking about maybe requesting some technical assistance for community level dissemination. I'm the PI, the local cohort PI for the Max Wise combined cohort study, which is a large multi-site cohort study. And I just and we collect data and specimens to provide to investigators, but we don't do interventions that are going to improve people's lives. So a community dissemination has been difficult for us to engage with, partially because we don't have Center for AIDS Research funding that allows us to do community events and things like that. And I wondered if it would also be appropriate to bring in people from my institution who might be interested in community dissemination, not specifically with my research study, but just wanting to get more information about community dissemination and community engagement. So does this TA focus on a very particular topic, project, that how to help that project move forward, or could it also be offered as general information?
So the plan for our training modules, there will be one for each of the things that you just talked about, one for community engagement and one very specific to dissemination within those communities. Our hope and our thought process is that you all would watch the training and then come to us and say, okay, I learned some stuff from here, but here's my specific situation. And let us help you with, because everybody's unique, right? You have specific communities, specific history with them, specific barriers potentially with them. But so then we could really focus the TA very unique to your situation. But we do plan on our both our resources and particularly the training modules that we're putting together to have a broader appeal. So that then when we get to the TA, I'm not trying to give you a broad-based thing. I can specifically work with your specific circumstances.
Okay.
So there will be something for both, I think. That's our plan.
And how long do you anticipate that those training modules that we would be watching ahead of time, how long would those likely be?
Our hope is to keep all of them in pieces that are 30 minutes or less. We want all of them to be divvied up into bite size. They would certainly build on each other, and there's a lot of them that will be interconnected, but we're trying to break down each of the topics to be something that is bite-sized, and that would be and that we could do in 30 minutes so that if you wanted to string together a bunch of trainings for an organization, you could, but that it's easier for people to engage with and absorb in that way. While I'm talking, I'm actually going to go to our module set, and I will put all of the topics that we're looking at this point into the chat for you all. Again, we hope to complete all of these over the next 8 months and get them up on the website. But we're also, when we get new requests, we may add to these. So if there are topics that you all see and think, oh, well, why isn't this a topic? We are open to that conversation and suggestions to really understand, what are the other needs that are out there in the community that we haven't gotten a request for yet.
Okay, thank you.
Sure. And I should caveat the things that I'm putting in there. This is all applying a data equity lens to each of these topics. We are not doing a 30-minute module in study design. That we recognize those are entire classes. That's not so just understand when I put up these topics that this is all applying a data equity lens to survey questionnaire design, for example.
And we do have a question in the chat. The question is the technical assistant only being offered to organizations, or is it available to individuals?
No, if you have a data project that you are working on, even if you are the sole one doing it, please feel free to reach out to us. One of the first requests that we got is from a researcher at UCLA who is working on putting together a database, and she is working by herself to pull this thing together and to develop the questionnaire that is going to populate this database, and we are working with her on it. If it's a research or data project, we will consider it. We may not be able to handle every single topic, but don't let the fact that you're the only one responsible for a particular topic be a deterrent to you reaching out to us, and we'll see what we can do. Did I miss any? Administrative data. Language domains, okay.
Do we have any other questions?
So if you want to get on our mailing list, as we get the trainings rolling out, I will be sharing that out with our community. I don't send things out, a ton of times. It will only be like when we have a bunch of new stuff going up on the website, or when we're launching new things, or if we have any really exciting announcements about any of the work that we've done. So it's not like a weekly thing or anything, but if you send me an email, I will add you to our list, and so or you can just feel free to just check back to the website on occasion, and you will see over the next several months those new resources and those new trainings get posted.
We have another question in the chat. It's, with that being said, would you assist with dissertation studies?
Depending on the study, sure. I mean, that this is not, we're not here to be for every dissertation candidate currently. But no, listen, the future researchers need to understand data equity. And so I don't want anybody to think that we're turning our nose up at that opportunity. We'll look at every project on an individual basis. And it may just be that we can point someone who's doing their dissertation to a resource that we already have. But potentially they may be a candidate. Again, just share the information with us about the project and about what the challenge is, and we will see what we can do.
How about if you need more than 8 hours, because it's only being offered for 8 hours, the consultation, correct?
So 8 is not a hard and finite deadline, because we recognize that every project is going to be a little bit different. But so it would be, we're not funded to do 50 hours of TA for everybody. And so we would look at that on a case-by-case basis and see whether or not we could find additional funding. But we need to understand what the request is in the beginning, to understand how much above and beyond what we're currently funded to do it would take, and then see whether or not there's something that could be worked out.
Is there any questions or? Oh, we have one.
I have a question. My name is Karen Messiah, and I was delighted when I saw this webinar, this Zoom meeting coming up, because I would just like to piggyback on the question regarding the dissertation. I am someone who just graduated with my PhD last year.
Congratulations.
Thank you. And I was looking to expand my research. And I heard you said that you will be available to give out that information and work with individuals who are working on current dissertation. But my question is, can I reach out to you to work, because I wanted to expand my research not only here in the United States. I was looking to expand my research eventually on a global scale. And I was wondering if it's that something that I can reach out to you, because health equity is definitely part of my research study when it comes to minorities, especially. And I was wondering if that's something that I can reach out to you to get some assistance with. Part of my dissertation challenges that I went through is the data, missing data and things like that. So those are questions that I wanted to know if that's something, an area that you can help me with, because I will be working individually in the future. Um, and of course, with others who wanted to come in on the project with me. But can I reach out to you with that, if
So,
for that
so you
kind of
can.
information and assistance?
Yeah, you're absolutely, feel free to reach out to us. As I mentioned, we are going to be doing trainings and putting up resources on missing data. So you may be able to just find something that is helpful to you in those resources. We would have to really look at the TA request, because Robert Wood Johnson is focused solely on the US and US projects. And so we have to be responsive to them. And so we would have to really understand what your needs were and see whether or not it was appropriate within the mission that we're being funded to do. But I'm happy to look at it and have that conversation.
Okay, thank you.
Of course.
I think I will just ask one more time if there's any questions.
I know
And
I've thrown out a lot to you guys today. My email is in the chat. Please,
yeah,
next week when you're like, oh, I should have asked this, just drop me an email. I'm very responsive to these things. I'm looking forward to learning more about what each of you guys are dealing with. And it may be 6-8 months from now. We'll still be here. So just don't lose my number.
right. Well, thank you so much, Dr. Scheitler, for your time and sharing this resource with us. And I hope that, a lot people here can utilize this service and this resource. And I'm looking forward to the training. So
Thank you very much. I will be in touch about the trainings, and I hope to hear from many of you if we can help in any way. Thank you. Have a great day.
Thank you.
Is there any way you can put your email address in
yes,
the chat?
it's
I'll
in
do it
the,
again. Yep, right here.
Oh, I didn't see it. I'm sorry.
No, it's okay. I'll
and
make
we,
it nice and easy.
And maybe some information on the mailing list, so that way we can jump on
Oh,
that
yeah,
as
if
well.
you just send me an email and I will add you to the list. Thank you all. Janet,
Thank you.
reach out to me if there's any follow-up questions that I can answer. Thank you.
will.
Excellent. Thank you.
Bye-bye.
Bye. All right. I guess that's our presentation for today. My apologies. I was running late from another meeting. So thank you all for taking the time to join the webinar. Great questions. I'll definitely go back and listen to the recording, because it sounds like a good resource that's available to us for the next few years. So please, if you need anything, have additional questions, don't be shy, reach out to Dr. Scheitler, and we'll keep on doing the great work that's already going on in our communities. Okay. All right. Well, if nothing else, I'll give you back 20 minutes of your time. See you in our next meeting in
Thank you.
April. Thank you.
Bye-bye.
Bye.
Thank you.